Frozen shoulder is a really hard condition to manage. Firstly, there's not always a great deal of information about it, particularly what causes it and how to manage it. A lot of the information just says it's a stiff shoulder, stretch it, which misses a lot of nuances in terms of what's actually going on and how we should manage it. Another point is it takes really long to heal. 1 to 3 years is roughly the time frame it can take, and anytime you have such a long rehab process, you're going to be a bit demotivated. Costs are probably going to spiral a little bit out of control if you get any treatment at all. So the length of time it takes really is a big impact. So that's hopefully what this video aims to help with. We're going to talk through exactly what's going on within the shoulder during frozen shoulder, how that relates to symptoms, exactly how do you feel and why, and how we can then translate that into management so we can really manage it correctly. And if you'd like help with management, I do have a frozen shoulder program that walks you through each phase with a detailed understanding. So if you are interested in that, the link is in the description. From the start, what actually is frozen shoulder? If you've never heard of it before, how would we describe it? In its essence, frozen shoulder is a gradual shoulder condition where we have gradual stiffening of the shoulder. It initiates with pain, so it first starts with a very painful shoulder. As the pain gets worse and worse and worse, then stiffness also creeps in to the extent that then once the pain starts to diminish, the stiffness continues until we get a frozen shoulder where there's not really much pain apart from when we really try and push movement, but there's a huge amount of stiffness, hence the frozen shoulder, what you may also heard termed adhesive capsulitis. Now it is what they call a self-limiting condition, meaning that it will heal itself over time. Now that doesn't mean it heals itself quickly. In essence, it can take 1 to 3 years. So yes, it does heal itself over time, but it just takes a really long time to do so. And as I mentioned before, the key symptoms really are it starts with pain, and that pain is really deep. So it's not a very local pain, because it's right deep in the shoulder joint, so it's a deep-seated pain, usually actually incredibly painful, and over time that pain diminishes but is replaced by stiffness, and all of that tends to come on gradually and doesn't usually come on from a single event and just continues to get worse and worse, and then that pain then translates into stiffness. In terms of what exactly causes frozen shoulder, if you look on Google or any other search engine, oftentimes it'll say there is an unknown cause. Now most of the time, whenever we have an unknown cause, really what it means is there are lots of different causes, and anytime we research it, because there's so many different causes, we never really get exactly one. So that's in essence my opinion. Frozen shoulder has lots of different possible causes, so a root cause that triggers a frozen shoulder, but the end pathway is very similar between people. So whilst we don't know the exact cause, it's more than likely the reason for that is that there's lots of risk factors and possible causes, and if you have a few of those that overlap, then you're more likely to get frozen shoulder, and once it begins, then it has kind of a usual trajectory. So there's no one known cause, most likely because there are multiple possible causes of it. Now, we do separate it into what we call primary frozen shoulder and secondary. And what this really is that primary frozen shoulder is where we have no idea what possibly started it. You might also hear it being termed idiopathic, which really means the same thing. We have no idea where this came out of. So those tend to be individuals where we don't really think they have any of the risk factors. Their frozen shoulder just came out of the blue, no cause known, and that's when it starts. We call that primary. It came out of the blue. We also have what we call secondary, and secondary frozen shoulder is when we can really identify that might have been the cause. Now, those sort of things are things like neurological conditions, Parkinson's and strokes. They can be post-surgical, so if you've had a shoulder surgery and then you get frozen shoulder, we say, ooh, could have been that surgery. And then we have things like trauma. If you've fallen on your shoulder, or you had a rotator cuff issue, or any other shoulder issue, and then the frozen shoulder started, then we term it secondary. So you have primary, we have no idea what caused it, and we have secondary. We have a rough idea where this may have come from. What is immensely clear with frozen shoulder is that it is not a simple condition. It is a complex condition. We have involvements of diabetes, menopause, autoimmune, thyroid, all of those have been interlinked with the possibility of developing frozen shoulder. So unlike other conditions, for example in the shoulder, but it kind of goes for the whole muscle skeletal system, it isn't simply mechanical. It's not that you fell on your shoulder or you use your shoulder a certain way. There's actually a broader health component because there are things such as hormonal, metabolic factors which play a large role in frozen shoulder, which means that it isn't as simple as other conditions where we can simply see, oh look, you're just moving incorrectly, we'll change how you move, give it time to heal, and you'll be as good as gold. It's slightly more complex because there are so many systems which may be playing a role. Before we get into the causes in a bit more detail, let's quickly go through the phases of frozen shoulder. And this is one thing which distinguishes it a little bit from other conditions as well. A lot of other conditions, you injure it and it simply just gets better until it's completely healed. But frozen shoulder goes through phases and each one is quite unique. And given the name frozen shoulder, they're all related to ice. So you have the freezing phase, you have the frozen phase, and you have the thawing phase. In essence, if you can think of it, it's the painful, the stuck, the moving phase. And it kind of goes through that cycle. So let's go through them. Number one, the freezing phase. So this cycle is dominated by pain. So we have a really painful shoulder. Usually it's quite hard to pinpoint it because the pain is from the shoulder capsule. And the shoulder capsule is the little sort of blanket that goes around the shoulder joint. So you have your shoulder blade, which makes the socket, and you have your humerus, the arm bone, which makes the ball. And covering that, trying to stabilize it, is the joint capsule. And that is where frozen shoulder happens, that joint capsule. Now you can't poke and prod it, it's a really deep structure, which is why the pain in frozen shoulder is really deep-seated. Now it might feel like it's coming from the top, but you really can't point to it like you would perhaps the rotator cuff tendons or other broader muscles. It's a really deep pain, often quite a lot more painful than simple muscle or tendon injuries. So that's the main thing. Now what's going on within the shoulder at this point is inflammation. We have inflammation within the shoulder capsule, and that is what is driving the pain. And this links to a few other symptoms. So yes, it's really painful, but it tends to be worse at night. And throughout medicine and physical rehab, any pain that we have that's worse at night, one thing we have to think of is inflammatory pain. So when we have inflammation, we have the hormone cortisol. And cortisol is highest in the morning and lowest at night. It plays roles to, wake us up in the morning, but it's also anti-inflammatory, such as, corticosteroids. So cortisol is anti-inflammatory, meaning that if we have an inflammatory condition like frozen shoulder, it'll be better in the morning because we actually have our natural anti-inflammatory, and worse at night as our natural anti-inflammatory is lower. So that's one thing. We have that freezing phase dominated by inflammation, meaning it's better in the morning, worse at night, and it's just really deep pain. The next phase is then the freezing phase. And what we look at here is something called atherofibrosis. What this is that if inflammation is prolonged and just continues, eventually we get a buildup of scar tissue. And actually the shoulder isn't unique in this way. We can have it after surgery. So if you've ever known somebody or you yourself have knee surgery, one of the big things we do first is stretch, because it's very prone to getting tight and scar tissue. So anytime you have inflammation, such as after surgery, but also these inflammatory conditions, you really seem to get a buildup of scar tissue that happens if it's prolonged. And this is what's happening in the freezing phase. We've had all that inflammation in the freezing phase, and now that we're in the frozen phase, the shoulder has an excess buildup of scar tissue, and that is now what is leading us to have a very tight and restricted shoulder. So now it's frozen. Over time, that scar tissue actually gets remodeled. So the body quickly patches up the inflammation with scar tissue, and it's not very happy with that initial scar tissue. It thinks it can do a better job. So over time, it remodels, rebuilds that scar tissue, and that is why the movement slowly comes back over time, what we call the thawing phase. and that is where we begin to have an increase in range of motion. The scar tissue has been built up, it's now being remodeled, so we're slowly getting a better range of motion. And that is the phases of frozen shoulder. It starts with inflammation and pain, that then turns into scar tissue and stiffness, and eventually that then gets remodeled, meaning that the shoulder begins to regain some of its movement. The time frame that this takes does vary greatly between individuals, but usually the healing is 12 to 18 months. But again, 1 to 3 years is roughly where we allow it, but 12 to 18 months is kind of what we see. And for most individuals, it will have a complete resolution of the frozen shoulder, so long as they do the correct rehab afterwards. However, for a select few, particularly those with diabetes, they may have some stiffness which just continues for life. So for most people, their frozen shoulder completely goes away, but for a select few, usually those with diabetes, the stiffness does remain slightly. So they do get most of their range of motion back, but not in totality. One question that also comes up is, why the shoulder? And we touched on this a little bit before. So the shoulder is a very vulnerable joint to inflammation. And the reason for this is it's very mobile. It has a very shallow ball and socket joint, which means that it allows us to have this really big range of motion compared to something like the hip, which is a bit more restricted because it's deeper. But because it has that range of motion, it is prone to injury. And if it's prone to injury, it's prone to inflammation. So that's one tick in the box. Along with that, in order for us to notice stiffness, it has to be a joint that we move a lot, which we do with the shoulder. So not only is the shoulder more prone to being injured and therefore inflamed, starting that cycle for frozen shoulder, but it is also more likely that we notice if it's stiff compared to the hip. With the hip, we don't usually use its full range of motion that often. So if it did go a little bit stiff, we might not always notice that as much as if we notice, oh, my shoulder's really not moving that much. So the shoulder hits those two vulnerabilities. It becomes inflamed easier, and we notice if we have any reduction in range of motion. As promised, we're going to come back to the causes in a little bit more detail now that we've gone through the phases. And what you will see is that because frozen shoulder goes from inflammation to scar tissue, anything which impacts either how much inflammation we have or how prolonged it is will increase the likelihood that we have frozen shoulder. Along with that, anything which causes the scar tissue to build up quicker or just the healing to not be as good, meaning that the scar tissue builds up, we don't heal properly, it just patches it up, that will also increase the risk of frozen shoulder. So that's why it's important to know what causes frozen shoulder, because it also tells you why we have the risk factors. If it's anything that increases inflammation, it'll cause frozen shoulder perhaps. Anything which reduces healing and recovery can also be a risk factor. The first one is diabetes. 1 in 3 individuals with diabetes will suffer from frozen shoulder at some point in their life. And the reason for this is that high glucose will both increase the risk of inflammation, but also slow down healing. So in essence, hits 2 points of possible frozen shoulder in one condition. So individuals with diabetes are really highly likely to possibly get a frozen shoulder because they increase the chance that inflammation occurs and is prolonged, and they increase the chance that the healing is substandard. The next is thyroid conditions, and it affects both those with hyperthyroidism, so an overactive, but also hypothyroidism, an underactive thyroid. And anything which impacts the thyroids tends to impact how things heal, and so thyroids will cause that scar tissue to build up more and quicker, meaning we're more likely to develop a frozen shoulder. So thyroid conditions, both high and low, are a risk factor and a possible cause of frozen shoulder. The next one is injury and surgery. Anything that causes us to limit how much we move our shoulder, such as if we've just injured it or we've just had surgery, increase the risk of frozen shoulder. The shoulder joint, whilst in frozen shoulder, it seems counterintuitive that if we stop moving it, that causes frozen shoulder. But at its core, the shoulder does need to be moved. It's a mobile joint designed to move. If we have a time where we're holding it very stiff, that increases the probability that it's just not very happy with us and start that cycle of damage and inflammation, which leads to frozen shoulder. So if we have a surgery in the area or we have an injury, not only will that possibly cause inflammation, but the lack of movement afterwards will also increase that risk. Next, we have autoimmune conditions. And autoimmune conditions really are that our immune system is hyper-responsive and hyperactive. And therefore, if we have even the smallest little bit of damage or inflammation within the shoulder, it's just going to be ramped up to the point which it might be out of control, meaning it then leads to that frozen shoulder cycle. So autoimmune conditions are a really big factor. And you may hear people say that we've now found out that frozen shoulder is an autoimmune condition, and really it's more like there's a subset of people which do have that hyperactive immune system, and so if they have any damage to their shoulder, that immune system is ramped up, the inflammation is prolonged and aggressive, which eventually leads to that scar tissue and therefore frozen shoulder. So whilst frozen shoulder might not be totally an autoimmune condition, those which have an hyperactive immune system are really vulnerable to possibly getting a frozen shoulder. Next, we have neurological conditions, and the two here are stroke and Parkinson's. Those tend to be the ones most researched because they tend to limit how much we move the shoulder. And again, if we don't move the shoulder, it tends to just not be very happy with us, can start that cycle of inflammation, which then leads to the frozen shoulder. So stroke and Parkinson's, another two risks for possibly starting a frozen shoulder. Finally, we have the menopause, and as we have that drop in estrogen during the menopause, it really impacts our ability to maintain collagen. And collagen really is the main thing that makes up things like ligaments and therefore the shoulder capsule. So if we have that sort of dysregulated collagen synthesis, so we can't maintain things with collagen very well, firstly, it may mean that we accumulate damage and that starts an inflammatory cycle. And it may also mean that if we do have a little bit of inflammation within the shoulder, it is more likely to have scar tissue and lead to that stiff shoulder. So menopause, the reduction in estrogen means that collagen isn't synthesized and made very well, which may impact either accumulated damage in the shoulder or actually the amount of scar tissue which is inevitably built up, giving us the frozen shoulder. With that all being said, how is frozen shoulder diagnosed? And it is a clinical diagnosis. There is no blood test or scan you can have for frozen shoulder. It is all based on how you present, the typical symptoms. And it's usually a combination of it doesn't look like other conditions and it looks like frozen shoulder. So it's usually a bit of clinical skill. But we're always looking for the pathway of frozen shoulder. The pain. Did it start with a bit of pain? It came on gradually, where it was very deep in the shoulder. It wasn't local like other muscle or joint conditions. So we have that deep pain. We have that gradual stiffening of the shoulder. And importantly, the stiffening of the shoulder, so that reduction in range of motion, is both in active and passive range of motion. And what that means, so we have active range of motion, which means when we move it. So when we move, we're using our muscles, and if we have a reduction in range of motion, then that might tell us that we have a stiff shoulder, but it might also tell us that we just have muscles which don't want to be moved, and that's the cause. But one thing with frozen shoulder is it also affects passive range of motion. And that means that if you relax your arm and somebody else moves it, it has exactly the same amount of frozenness. It doesn't move as much compared to what it should. So it's both active and passive because it's not anything to do with muscles or tendons, it's all about the joint itself. In terms of imaging and X-ray and MRI, they are really only needed if there is suspicion that perhaps this is actually something else. So the clinical picture isn't perfect, something's just a little bit off and we need to check to see is there actually something else going on. Or if somebody has done, 6 months of rehab and it's done absolutely nothing, so nothing's budged, and we might want to see, so it's not responded how we expected, we might want to see, is there actually something else going on? So those are the two occasions you may need a scan. Either the clinical picture is not perfect and we just need to double check to see if there's something else going on, or treatment hasn't done anything as we expected, and so then perhaps we need to scan then to again see, is there actually something else going on in the shoulder? Now let's quickly look at management. And again, if you want help with management, there is the frozen shoulder program that I put together in the description. But broadly, when we look at management, because frozen shoulder has those 3 separate phases, we really have to have 3 separate management plans. We have the freezing phase dominated by inflammation, and in that case, we're all about protect the shoulder, reduce the inflammation as much as we can. And this is where corticosteroids can also be used. So freezing phase, it's painful. We want to protect the shoulder, reduce inflammation, bracket, perhaps corticosteroids may be helpful. So if you have frozen shoulder and it's currently painful, corticosteroids may help in that initial phase because it does have a lot of inflammation. Then once it's stuck and frozen, it's not so much inflammation as it is scar tissue. So it's all about trying to regain range of motion. And this is where stretching does help. Now you may perhaps opt for a surgery, a hydrodilation or a capsular release, but those usually are only left for individuals where there doesn't seem to be any response at all from regular stretching. So that the frozen phase dominated by just regaining that range of motion. Once we get to the thawing phase, so we've regained most of our range of motion, it's all about just restoring the shoulder back to health. Because more than likely it's been used in an awkward way, the muscles have changed in terms of their strength or coordination, and we just have to get it back up because we are at risk of developing other shoulder issues because things are weak, things move a bit awkwardly, and perhaps that changes how the shoulder moves ideally, increasing the stress on other things. So the thawing phase, the management is all about regaining the strength in the shoulder. So freezing phase, inflammation, try and protect the shoulder. The frozen phase, stretch it as much as you can. The thawing phase, build up that strength as much as you can. And the main modality tends to be conservative rehab, so that's exercises and stretches and changes to our day-to-day activity. But we do have things like steroid injections. They can be helpful in the initial painful phase. We have hydrodilation, which might be helpful when it's scarred over. And surgery really is a last resort where nothing seems to be impacting it. And the surgery tends to work better when it's in the frozen phase, not really whilst it's painful and inflamed, more once it has frozen and the scar tissue has built up. That's when the surgery is required. And that is an overview of what frozen shoulder is. It's a condition which initiates with inflammation, it then becomes scar tissue, giving us the frozen shoulder, and eventually that scar tissue remodels, giving us a little bit of thawing, and we regain our shoulder. And anything which impacts either inflammation or healing will be a risk factor, which is why diabetes, autoimmune conditions, thyroid conditions, and also the menopause are risk factors for frozen shoulder and might be something that we can impact as well to try and improve our management. And if you do want help with the management of your shoulder, then I do have that little program in the description. And if you'd like to see more videos from me, then see the little suggested video just here.